Hello, good day. Welcome once again to Medical Files, brought to you by Studio 77, where your health is our priority. I'm Ade-Adeleke Favour Eewajesu, beauty always on duty. And today we'll be looking at a health condition that many people, especially older adults, are familiar with, and it's called arthritis. When you hear the word arthritis, what comes to your mind? For many, it's pain. For many, it's stiffness. For many, it's swelling in the joints. And while that is true, arthritis is actually a broad term that includes over 100 different conditions that affect the joints and surrounding tissues. Now let's get into it. What is arthritis? Arthritis is not a single disease, but it's actually a name for many different joint problems. In fact, there are over 100 types of arthritis. But don't worry, we'll only be focusing on the most common ones today. And there are two main types of arthritis. The first one is the osteoarthritis. The second one is the rheumatoid arthritis. Now let's look at what osteoarthritis is. It's the one most people know, and is often called wear and tear arthritis. It happens when the bone in the joints start rubbing against each other because the protective padding that cushions the joint breaks down or wears down over time, causing the bones to rub against each other. If cartilage breaks down or wears down over time, causing the bones to rub against each other. It usually affects older people and joints that work hard, just like the knees, the hips and the hands, and it leads to pain, stiffness and sometimes swelling. Now let's look at the second one. It's called rheumatoid arthritis. This one is actually an autoimmune condition, and it's a bit different because this one, the body's immune system that's supposed to fight against disease begin to mistakenly attack its own body. Right? This one is actually very different because it's an autoimmune disease. An autoimmune disease is such disease that occurs when the body's immune system that's supposed to defend the body against disease begins to fight against the body. So your immune system begins to fight your joint and thereby causing this arthritis. And for this rheumatoid arthritis, it can affect multiple joints at once and even organs like the lungs and the heart. If not treated early, it causes swelling and can damage joints if not treated early also. And there is actually one that we should not miss, and that's called gout. What is gout? This one can cause sudden, very painful swelling, and it occurs mostly in the toes or other joints, but it starts from the toe. It is caused by a buildup of uric acid crystals in the joint, especially the big toe. I mean the big toe on your foot. Now, what causes arthritis? They can vary depending on the type of arthritis, or there are some general risk factors. Now let's look at them. Age is a risk factor when it comes to arthritis. As you get older, you are at risk of having arthritis. Gender, women tend to have arthritis compared to men. Another one is genetics. If there is a family history of arthritis, you can be at risk of having it. Another one is joint injuries. Maybe there was an accident and it affected your joint. Such person is at risk of having arthritis. Obesity, when the person is overweight, the joints might not be able, especially the hip and the knee, might not be able to carry the weight, and therefore it leads to arthritis. Another one is autoimmune condition as seen in rheumatoid arthritis. What are the symptoms of arthritis? Let's look at the symptoms of the first one we mentioned, which is osteoarthritis. The symptoms include pain during or after movement, joint stiffness especially in the morning or after rest, loss of flexibility, grating or cracking sensation in the joint. You begin to hear that your joint is cracking and there is this sound coming from it. Bone spurs, and that one is extra bits of bone. You begin to find some extra bits of bone around the joint. And also the symptoms of rheumatoid arthritis are as follows. We have the swollen tender joints, there is fatigue and fever, there is morning stiffness that lasts longer than 30 minutes, there is weight loss even without attempting to lose weight. Such person with rheumatoid arthritis tend to lose weight. There's joint deformity in severe cases. Rheumatoid arthritis can come in flare-ups. There's a time that the symptoms will be very severe and it will go down and it will come up again. So it's more or less like it is persistent. Then how is arthritis diagnosed? One thing about it is that it's doctors that diagnose this arthritis. You cannot diagnose yourself of having arthritis. You have to see a doctor. They do this by physical examination of the joints. They do blood tests, especially for autoimmune disease like rheumatoid arthritis, x-rays or MRI scan to see the extent of joint damage. They check patient's history, maybe there's the symptoms, the duration, and the lifestyle that such patient has been living. Now, early diagnosis is key, especially for autoimmune arthritis like rheumatoid arthritis, where early treatment can prevent permanent joint damage. Now, can arthritis be cured? Sadly, there's no cure for arthritis, but there are many ways to reduce the pain and make life easier. So the first way is medications, and it's always prescribed by a doctor. Let's look at the medication options. So doctors may give such person pain reliefs like paracetamol, corticosteroids to reduce inflammation, disease modifying anti-rheumatic drugs for rheumatoid arthritis. There are also biological agents. Those ones are advanced drugs that target specific immune responses. And there's another way to manage it, which is lifestyle changes. And example of lifestyle changes is weight management. You begin to work towards reducing your weight if you are obese. Exercise. Low impact activities like swimming, walking, or even yoga can reduce and prevent arthritis. Another one is healthy diet. You begin to eat good food, especially food that are rich in anti-inflammatory properties. Examples of such foods are fish, nuts, fruits, and even vegetables. And then there's joint protection techniques such as using braces, cranes, and modifying activities to reduce the strain. Now, the third way to prevent or reduce it is physical therapy. Physiotherapists can design joint-friendly exercise to help maintain strength and mobility. And another one is surgery, because in severe cases, joint replacement surgery is done, especially for knees and hips, and this surgery can be considered as a treatment option. And now, let's look at the life of those living with arthritis. Does not mean you should give up on your daily life. With proper management, many people continue to lead active, fulfilling lives. And what you have to do is just stay active, eat well, follow your doctor's advice, and don't ignore your symptoms. Support groups and counseling and education about this condition would also go a long way. But many people are not even informed about what arthritis really is. It will also make a big difference in emotional well-being. Let's look at arthritis in Nigeria. Here in Nigeria, arthritis is actually underreported, but it is very common. Many old people like our grandparents, our uncles and aunts, they suffer in silence because they believe that joint pain is just a normal part of aging. But joint pain isn't something to ignore. Cultural beliefs and high cost of medication can also be a barrier in Nigeria, and that's why awareness is so crucial. The earlier you treat it, the better your joint will be in the long run. Now let's round up. To sum it up, arthritis may not be curable, but it's definitely manageable. Whether it's osteoarthritis from aging and overuse, or autoimmune forms like rheumatoid arthritis, the most powerful tools are early diagnosis, consistent treatment, and lifestyle adjustments. So if you know anybody experiencing joint pain, stiffness, or swelling, don't ignore it. See a doctor. The earlier you act, the better the chances of living pain-free. Listening to Medical Facts brought to you by Studio 77. I hope you'll be able to learn one thing or the other. You can do well to give us a like, share, and also comment. Join me again next week, same time, same platform. I remain beauty, always on duty. Till then, stay active, eat healthy, and take care of your joint. Bye.